Let us start one example, clinical example. What is the limitation of a Ayurvedic doctor, a BMS graduate? I will share a history of a case. A patient from Karinagapalli, and he consulted one allopathy hospital with this lesion. This was the lesion. From this, by this lesion, they consulted a allopathy hospital, and a dermatologist took the biopsy and they diagnosed the morphology features of guttate or eruptive psoriasis. And there is a word correlated clinically. And by knowing that it is a psoriatic patient, since in allopathy there is no medicine, they told there no effective medicine. This maybe 21 years old guy consult a BMS doctor, and a sick psoriatic patient, he applied this Ayyapala Kerthalam and some Kashayam, Arishtam, Gulaja, Lehem, etc. Within 4 days, this eruption is increased and it became this much of exacerbated lesion. The patient is very much mentally disturbed. And by this, in this condition, maybe somebody told when they contacted me, it was in the COVID season. So they contact me through video and send all the reports and their biopsy also. So what in this condition, why it is increased due to psoriasis? Psoriasis or Shetakurja or Aichatingra is the Turpu sheet of the all BIMS and even the specialist of Ayurveda. But it is not a one word of the psoriatic patient. In that Shetakurja, Asya Patram Kadushnam Cha Kabhavada Vinasham. It is Kabhavada Shamanite due to Ushna and Kadi, it will increase the Pitta. Since the patient is Pitta Prakriti, the dosha at that time it was Pitta. This due to application of this Ayyapala Kerthalam, that is exacerbated increase, the patient was not able to hold their hand. So actually this Ayyapala is contraindicated Pitta Pradhana Yoga and Pitta Nibandha condition. So in that case, the patient consulted me. And so in this condition, what we can do? This is one local man I consulted with the video call. And since at this condition, itching and scaling, and history of, and the patient after analyzing, there is a history of atopic dermatitis. And the patient is Pitta Prakriti. His ESR and immunoglobulin E is rise. So actually, and not only that, he is an architectural engineering student, and his food habits, ugly food habits, 2 times chicken and paratha. And night he is studying because architecture has a lot of work. Night up to 12 o'clock, he is working with a severe tense. That time he is this way. This is his routine. So actually, in this, we can diagnose the dosha is Kapha Pitta dosha. And there is a Gara Nidana. By identifying this in that type, we have treated with simple medicine. Only we are given Guluchedi Kashayam and Vilyadi Guliya, and washing with the Lodra Sebia Kashayam and applied Mahatikta Kritam. Within 2 weeks, the patient is become like this. Only few lesions here. So this is the one of the history of the case recently in the lockdown period came to my OP. So what is the importance of psoriasis in this country? Today we have psoriasis day celebrating all over the world. But this simply celebrating psoriasis is not good. Understand the psoriasis as far as Ayurveda people concerned. What should be our approach? So this might diagnosis psoriasis or diagnosis psoriasis, confused management. If you are getting a diagnosis by the modern people as psoriasis or ichnoal, it may be the management will be confused because psoriasis, everybody think it is psoriasis, Ayyapala and other medicine. There should be. So that is not the way of Ayurveda in the clinical practice. So in this condition, what is our approach should be? What should be our approach? As per the traditional Ayurvedic way, approach will be, see, in that I have a creative destruction statement. These are the easier to mind. This should be very useful for you. I don't know what is psoriasis. Even though you called me for the class, I'm telling that I don't know what is psoriasis. I don't know how to diagnose this, and I don't know how to manage the psoriasis. But we can manage effectively and economically the patients suffering from psoriatic type disease with Ayurveda principles. But what is that principle nowadays? That is very important here. Tell me. So you are seeing this typical. Most of the patients came to my OP with referred by some of my students, some of the doctors, and although even though they are coming with their biopsy report, so I diagnosed psoriasis like that. But we have to think in the reverse pathology when Rogatnyanam. Apply your pramana. This is the patient came to my OP, referred by a student. Sir, this patient was a psoriatic patient. I am referring this patient for your expert management. And by my approach, traditional approach, apply the pratyasha. What are you seeing the pratyasha? Yes, we are seeing some behi rukshada, some snigdha inside, anda snigdha, some exfoliation, so rajakiranan, and the white scale with reddish color. And by analyzing the patient is pitta prakriti, and by the history, we came to know that he is having a full of virudahari in his lifestyle. So, and also his agni is not proper. So, by the signs and symptoms, it is a kabhavada roga. And so, apply what is anumana? Yes, by the kabhavada roga, you can anumana what are the vata disease of kabhavada roga is. And also, you upama, if you have a previous experience, you upama is like that. And what is the apta vakya telling? So here, in that, what are the disease occurred in the here? You know, what are the signs and symptoms of dosha vijindram? How I told it is a kabhavada. What are the dosha vijindram? Here, in Charaka, there is a quotation. Daucham shosha toda shulam sangojam zadayama. Parishyangara bhavo harshashyavarunatam cha. Kushteshu vadilingam daho ragavaristrava pada. Visragandho kledattadangabadram cha vittakrit. Shaityam, Shaityam, Kandu Stairam, Chulseda Gaurava Sneha, Kushteshuta Kavadilingam, Jandubirabivakshanam Kleda. Here, you can see some Rutshada. You can see Shavarunatam, Parushada, and little bit Kledam, only slightly Kledam, and slightly Shaityam, and Kandu, Sthirada, Ulseda, Gaurava, Sniktana. Some little bit Kleda. Kleda means in this case, it's inevitably Klesha will be. So by this, what are the dosha here? Vada, here pitta is less, and kapha is, and now it is vada kapha. Kapha will go, so it is called kapha vada roga. So in this kapha vada roga, dosha is kapha vada. So what are the kapha vada or vada kapha increased dosha in here? As per the apta, or by my previous experience, even though it is kapha vada, if you can include in the vada kapha roga due to the dryness, more dryness, and the other garadanya nidana. Due to the Gara Vada will more increase. Here, what are the Vada Kava increase roga? Here, Charma Ega Kusta Kidiba, Sitma Alasa Vivadiya, Vada Shleshmodbhava, Shleshmivta, Dedru Shadarushi. Maybe in this it is condition it will come. So, as per the Aptavakya, as per the clinical evaluation, the disease will be diagnosed can be in this condition. Here, most of the signs and symptoms correlate with the Sitma Kushta. So here, Sitma Juksham, Begistigam, Andagrishtam, Rajakire, Shlakshas Parsham, Tanu, Sheda Tamram, Daudiya Pushpavan, Prayana Churdhagayesya, from Nabi to upward. So by this, you can diagnose the patient as a Sitma Kushta. And here, so this is the condition. By this, you can diagnose what is the Roga. It is Kavavada, it is a Sitma Kushta. And so we understand that it is a Sitma Kushta. Even it is Vada Kapha is more increased due to the Nidana. So Vada Kapha Vada Roga. And this no Charaka states Sitma is Kapha Vada Roga. Vagbra tell it is a Vada Kapha Roga. The Kapha Uklesha a little bit more. So it is a Vada Kapha or Kapha Vada Kapha Roga. Sitma Kushta. This is our diagnosis. And what is the Samprapti? Samprapti, as per Ayurveda, Yaktavaka Sodo Dushti, Ulklesham. Vidyahara Viharana, Virodhi, Visheshana Virodhira. I will tell you the Samprapti in a different way because it will very deeply we can study. So here, yes, in this, in the traditional way, we are going in the Bhaudya, Bhudebhya Viram Chinda Nasi Chinda Chinda Chigilse Charakasi. So, what will the Bhaudya in the Bhudakarna? Actually, it is a Vada Kavaja. Vada Kavaja means Rasadadu Dushti, Jalamsha, Shosha. So here, actually, Agasha Vayu, Atha Mitam, Amba Pradvibhya Shleba. Here, Vata and Pitta is in here, Jala Buddha is less, Agni Buddha, Vaishramam is there, Vayu and Pradvi Buddha is increased. Jahara Viharena, Visheshana Virudana, Sadhu Nindavadasu, Anya Sarabha, Sarvi Kamijo, Praknevi, Ramala, Sira, Pramadya, Jakta, Tolis, to Plesiga, Sagamisham, Dosha, in the Shligritya, Dusta, Kusta Pusha. These are Sambrati. Even after Sambrati, what is the Sukshma? It is the Sukshma level we have to think. So this is the condition. So here, what may be the treatment principle? Here, in the treatment principle, you can see that here the management will increase the Agni Jala Bhuda, or correct the Agni and increase the Jala Bhuda in the body. So how can we increase the Jala Bhuda in the body by correcting the Agni? The best choice is Gridam. And also in this condition, the body became Duksha and Ushma. And we want Shita and Snigdha. So Grida is ideal choice here. So in this patient, normally we are giving Mahatikta Gridam internal and external after a Costa Virajana with Avipati Churna. And the externally also washing with salt water to reduce the kapha. Just salt water wash and apply Mahatikta Gridam externally. In daily also you can Mahatikta 10 ml morning. And if any itching is, you can give Haridra Ganda or Vijadiguli. Haridra Ganda and Vijadiguli, being a Gara Nidana. So after Costa Virajana, because Girda should be done only after clearing the Costa. So if you are applying this principle and if you are doing this type, the result will be within after 2 weeks. This is the reaction. After 2 weeks of this treatment. So this is an example of clinical approach or traditional way. My tradition. But and another on incidence side, this patient is very, very clear for the last 5 years. But after this COVID, when he took a COVID vaccine, this again precipitated. But this precipitated by a COVID vaccine, and same treatment is cleared. So this is the traditional method of approaching psoriasis as per my clinical experience here. Now, but no. Now what is the problem? Nowadays, we can see multifactorial etiological causes and multi-dimensional pathological manifestations in dermatology. So we want multi-level applications of management methodology for targeting, cleaning all the sloths, stimulating all the agnis, enhancing the organ functions, motivate the micro-metabolism, aiming dosha samyam or prasadana. This is the newly developed principles of dermatology treatment. So here, so but why? Because nowadays this Acharya written our book in 300 BC or maybe Vagbada is the 6 AD. So the etiological factors, the lifestyle, food habits, everything is changed. So that is why multifactorial etiology, multi-dimensional management should be there. For in the Nidana Parivardhanam, Pradikriya, Samdapti, etc. What is the contemporary important? Now, previously we are taking class like this. Now we are taking, now from 1980, we are past 2020. Now this was the your class. Technological development, that technology affects our health also. And our science, it was coming from the Buddha tradition. Buddha is the actually Buddha is the god of nowadays because from the Buddha it is spread all over the world. We are in Ashtanga is also written by a Buddha Bhikshu or Buddha Guru. In that Buddha influence is Ayurveda. Actually, Buddha helped Ayurveda to spread all over the world to develop. Whatever history we studied is wrong. We study that Buddha Mata is a cause of decreasing the Ayurveda. No. Buddha actually increased the scope of Ayurveda by spreading to all over the world. And it passed to our rishis. And from the rishis to Vedajna. And from the Vedajna it passed to Ashwalaya. And it is to Acharya and the new gen. But in the new gen, you are in the new gen. So I told you nowadays we have to think in another way. So that is I am telling you. So we have to understand that Emam Shastramadiya Nuna Vidya Shastranasya Tasmat Bahusram Shastram Vijaniya Chigilsa. Now, what is the modern people telling, allopathy doctor telling about psoriasis at present? It is a papillus commerce disorder. The well-defined erythematic plaques with exfoliation. Chronic and non-contagious. It is an autoimmune disease. It depends upon that is by post-vaccine. It increase an autoimmune reaction. It's an autoimmune disease, and the remission and relapse is the most problematic to the patient. In the world, 121 million people are affected globally. Incidence rate is 1.5 to 3%. No sex discrimination. Any age it can come. First onset 15 to 20, which is a question mark, but any age it is coming as per my experience. Now this is. Next we can tell. So what is the morphology? Morphologically, usually it starts at the extensor surface of the extremities and buttocks. Usually it is a dry lesion, but flattened bumps or red patches, red and large thick flakes, well-marked boundary. That is a diagnostic criteria. And loose silvery scales, so like Kiranam. Now, here, what are the cause? The exact cause is not known. That is important. Not known. It may be genetic, maybe autoimmune or environmental. The master switch is still a mystery as per the history. So that in that continuous psoriasis day, and that is present the psoriasis day. Everybody is celebrating psoriasis day in the mystery thinking. So whether it is genetic, relatives of 1/3 cases have psoriasis. But you cannot believe 750 crores of people in the world. It's a random sampling. We cannot believe that. One of the parents, 10% chance. Both the parents, 30%. Normally, it is a kulaja or Garbhaja Roga can be occurred. Many genes are associated. It's genomic, it is coming. That's all I told you in the Bhaunja Bhaudika level. Agni Buddha and Panchabuddha Prithvi. And it is coming from, actually, it is coming from the mother. The only from the Mamsam Ethia coming from the mother Jamkias. So Saumya Dadu. So maybe some genes may be okay. 9 locations on different chromosomes. It's now identified. Major determinant is P source 1. Source 1 is located chromosome 6. Maybe it is coming, but we cannot expect the full proof for the etiology and the full proof as a curative purpose. Which control important immune function is. These are the genetic. And whether it is a immune related or autoimmune, immune cells move from the dermis to the epidermis, and T cells migrate reliefs of cytokine in a cytokine, and these cause tumor necrosis factor A. These are some of the factors which identify causes of the autoimmune, and these are the causes of inflammation. In psoriasis, in the dermis, inflammation is there. So due to this, and interleukin is also, it is keratinocyte to proliferate the dermis, the epidermis, and dendritic cells induce the proliferation of the T cells. So these are the factors which pointing the causative factor in the autoimmune factor. So here, next, what are triggering factors? This is very clear. What are the triggering factors or precipitating factor or the Viprakrishna Nidana? The Viprakrishna Nidana will cause the Sannikrishna Nidana, and here the stress is a very important psychological factor. Our Acharyas are telling, and the climate. In some climate, Vata Kabaja Roga, actually the psoriasis will in the Rucha Kala, this November, December, January, where the Rucha is Vata Kabaja is small. And medicines, some of the medicine will precipitate lithium salt, beta blockers, and chloroquine. Hydroxychloroquine, the COVID, after the COVID, when the treated with hydroxychloroquine, some of the patient came to me by increased level. And nowadays, the post-COVID vaccine also causing precipitating the and some of the cosmetics, especially some dye and other cosmetics, and trauma. The trauma, the lesion will be usually the psoriatic lesion precipitates the trauma because it first occurs in the head. In the head, we are combing. Due to the comb, the stress trauma is causing the lesion. And as some in the elbow joint, always put in the elbow joint in the chair, that called friction. Wherever the friction is there we can see the lesion more. And some of the infection and more prone the dry and skin people, and food and alcohol extra will be precipitating this one. So these are the triggering factors. So what is the pathophysiology is very interesting. And we can see excessive turnover of keratinocytes, dilation and coiling of superficial blood vessels. That it is coming in the circular way, coiling of the blood vessels, leukocyte infiltration into the skin, mononuclear papillary dermis, neutrophils in the stratum corneum we can see. Interfollicular epidermis is not affected. That is one of them. And there's a T lymphocyte migrate to the dermis, and it is released an enzyme called the cytokine. And this will trigger the proliferation of the keratinocyte and increase the level of prostaglandins. We can see increased growth fraction 30%, 100%. And start skin exfoliation within 2 to 3 days instead of 28 days. Normally, our body exfoliating the epidermis within 28 days. It is natural. Within 28 days, our body will become new one. We become punarnama after 28 days because one layer will be going. But in psoriasis, it's occurring 2 to 3 days due to the proliferation of the epidermis. This is the and so how you can modern people diagnose morphology, erythema, induration, itching, and scaling. You think that 20 years back, this itching is not included in the morphology. When I am studying and I am teaching the patient, in 1992, 1985, maybe my first experience of it. In 92, I treated one patient first. And that was a very, very rare patient, rare cases. So now it is increasing. So that is my 30 years of my clinical experience. When I entering the psoriasis is very rare, very, very rare. So first patient I treated, still he is living. He's 76-year-old person, still living. And that I document everything. So in hospital side, pinpoint bleeding we can see. And the coagulase phenomenon, because we are scratching, the lesion will spread to the scratching side. And skin biopsy is called a skin biopsy. These are the skin biopsy. Hyperkeratosis, marked thickening of the stratum corneum. He has thickened stratum corneum. And diminished granular cell. Granular cell, that is granular tissue will be very, very less. And elongated dermal papilla. And patchy infiltration with the dilation of the capillary. So this is the histopathology of psoriasis. Here, you have to think that even though the actually it is a dry lesion, some reddish color is there. But these coagulation due to the dermis capillaries, coiled capillaries. So here, even though you are seeing actually very, very dry lesion, in the dermis, there will be dilation and the accumulation, infiltration. That is utklesha either. That is our utklesha. So that is our Acharya telling that Ididoshe Vijide Ande Tokshe Shamane Behi play. You have to do some Virajra Costa showing Uklesha Shamana. First you do internal purification Shodhana, then only you are supposed to give external application. Nowadays, most of the doctors are not doing proper Shodhana. Without doing Shodhana, if you are applying something, it will increase. And some old wise that it will now our the root is coming out through the skin. No, it is our mistake of not clearing the sawdust first. Then only we are supposed to take Indian. That is why given Virajana Vipatti and giving in Indianly Grida and the externally application. So by this, our pathology is very clear. Tuklasiga, Asriga, Amisham, Doshayandi, Shadi Gritya, Dushta, Kustamisham. There is Utklesha either. Externally is very different. Inside it is Utklesha. Here it is the Dosha, Kapha, and Vata. When more inflammation is there, it will be Pitta. As per that, you have to think of the Vata, Pitta, Kapha. Sorry. Yes, easy. So, as per the modern classification, there are several types of classification that are visualizing that is the modern way. Gutted psoriasis, plaque psoriasis, pustular psoriasis. As per the site, maybe flexural psoriasis, palmar plantar psoriasis, scalp psoriasis, nail psoriasis. Even though all these are described, there is no effective treatment in allopathy. That is the nowadays condition. So, this one of the classification. Gutted psoriasis. It should be small, rounded erythematous lesion, 2 to 3 mm diameter minimum scale. Hyperkeratosis will less degree, followed by an acute febrile illness, confused with the drug rash. And also, this gutted psoriasis also mimic the lichen planus. In the lichen planus, blood violations papules with severe itching. And it's not too chronic. It will not recur. That is the diagnosis. Now, this is one. This is a plaque psoriasis. And here the hyperplasia of the epidermis, large raised lesion. This is actually the symptom. And reflecting defective vasculature. Here you can see the vascular pool here. When the scale is gone, you can see reddish colored pinpointed bleeding. That is called pinpointed bleeding or spit site. And the thick, loosely adherent scale. epidermal proliferation. This lesion, the capillaries will be dilated and coilated. This coilated lesion is seen in the round area, and it is exfoliating. You can see the coilated capillaries as a reddish color. In our side, it's called Rektavaha Srododushti. So these are plaque psoriasis. These are pustular psoriasis. Raised plaque with the pustules, you can see the pustule, and red and tender body. Localized or generalized with the fever and systemic upset. Complications like dehydration, electrolyte imbalance, hypocalcemia, hypoalbuminemia, and septicemia. You can see the pustular psoriasis. These actually the pustular psoriasis in our science we can call it Visarpa. That is the condition, Visarpa. And it is psoriatic vulgaris. It is affect all over the body, severe scaling in erythema. Actually, this is in our science, it is Kushta Roga. Not sigma, not psoriasis. It is called Kushta. This is flexural psoriasis in the flexus. The L flexus appears as a smooth, inflamed skin and the skin fold, armpit, thighs, genital region, under breast, etc. And under breast, the brassiere and the jacket will cause irritating, more it is more irritating and the severity will come. Aggravated by the friction of the dress and chance of fungal infection also you can see in this condition. So this is palmar plantar psoriasis, erythematic, thick silvery scales, sharp margin, confused with the eczema and fungal infection. This is our sign is called Vipatika. Vadika Vipatika. Now this is called nail psoriasis. Most of the people have nail, finger and toenails are affected. Approximately 50% will be there. And they start from the tip of the tip and it is pitting in the corner and thickening also. Misdiagnosed with onychomycosis, that is fungal. In the fungal, they will not be pitting. It should be spread in this area. And the itching will not be there. Here, scalp psoriasis. Prayana Churdagayasya. Do not extend beyond the hair margin. Hair margin the upper thing. Do not extend the hair margin. Usually erythematous causes great discomfort due to the scaling, confused with the dandruff and seborrheic dermatitis. Seborrheic dermatitis will be some sort of sticky material will come from the head. And dandruff is only itching, small powder will become. So that you can diagnose it. Because unless if you are not diagnosing the differential diagnosis, the treatment will be failed. Here. Now tell me what are the etiological features in Charaga telling. And even though the modern people don't treatment, our science clearly describes, good in the traditional way. In the Charaga telling that, in that, Shidoshna Lagdinaharam, Karmabukta Shevanam, Karmashtamavayatanam, Dhum Shidambi Sevanam, Ajirna Adyashanam. This is very important because at a time and the body is subject to different climates. Nowadays it is seeing that in the, even though not in the Gulf area, on here also, the people working in the AC, full time they are sitting in the AC or they are traveling in the AC car. Occasionally they will stop and they will come out of the car or coming out of the AC room. And so the body is subject to the heat. After 5 minutes or few minutes, they will again come going into the AC. So body at a time, body will be subject to different climates at a time. So the acclimatization process will be altered, the heat regulation mechanism, and even the hypothalamus will be altered. Even though when the stress is attached, the heat regulation mechanism is altered in the body. That is a causative factor of pathology. And also Navana Didimalsya Tila Lavana Amadishe Vinam Masha Mulaka Pishtana Tila Chira Budashinam. This is very important. So all these are very relevant in nowadays. If we are analyzing a 100 or maybe population you are getting or the PG students can conduct a study. Take a 500 psoriatic patient. What are the etiological factors in that patient? Like that, conduct a study and give to scientific world. This is the duty of the new gen doctors for studying the PG. I'm just simply picking this disease. No, you can the wide scope for the research. So these are the etiological factors. So let us look at what are the contemporary concept of the psoriasis. Modern concept. Formation of endotoxins, release of free radicals, increase in the body temperature, decrease the sweating. Yes, but psoriasis patient will not be seeing in sweating, even though they are feeling heat. Hypothalamus disturbance will be there, and defect the temperature regulation. And also the cause will be psychological stress, and it will affect the hormonal status and release of adrenaline in the body, increase the body heat, affect the hypothalamus. Here, it will alter the forces in the body, and also its coagulation of the artery will come due to the increased due to the adrenaline release. The capillary will be dilated, it will be coiling. So it is a etiological factors, multi-process in the pathology, and the coagulation of the artery, it increases proliferation of the cell, and this will result in the distribution of the force in the skin, intraepidermal coherence or dermoepidermal adherence. By these two forces, the skin intactness is keeping as a, because it was made up of different cells. Even though some connective tissue is there, that is controlling by some forces. It is called intraepidermal coherence and dermoepidermal adherence. That's the force. That force is called Vata dosha in our science. So the Vata dosha should be protected very well to control the forces or the shakri of the Tukindriya seat of Vata. So here, these are the formation pathology. These are the cause, these are the pathology. Here the temperature regulation mechanism in the hypothalamus effect. And as for our side, apatya ahara vihara and manasika yoga etiology. It will cause rakta dushti and rakta vaha sroto dushti. Here, increase the coagulation of the artery and dosha dhatu bala sammurchanam, kosha nasham. Kosha ingredient proliferation and immature cells are coming. That it will affect the mitochondrial layer of the cell. The mitochondrial vibration of the cell is altered. Due to that, immature cell is going out. That is happening here. And the Togga Vigalanam is happening. Due to the Vata dosha in the disturbance, the upward movement of the kosha or Togga Vigalam or exfoliation is increasing. This is the etiology and pathology of psoriasis happening nowadays. So here, just our approach, this is the sloga of Charaga, Saptadravya Gushtanam, Pragriti Vivamanani Bhavandi, Tadida Trayodasha, Vadapitta Shreshmana, Pragoda Vigrada Aha, Dusha, Chashira Radava, Tuk Mamsa, Shonda, Lesika Chadurta. Eda Saptanam, Saptadadum, Evangadam Ajanam Gushtanam, Ada Prabhavanya Bhirtamanani, Kevalam Shariram Upatavandi, Adava Kristam Shariram Yapnoti. The pathology is deep rooted. First, the Saptadhatu will become vitiated and that coming to the skin exfoliation. That is our science. And suppose, what is the importance of this? You have to think in different Sitma Kushta or psoriasis. It's a correlation. No, you don't bother about the psoriasis. You think in the Sitma Kushta. Even though it is Sitma Kushta, you have to do Doshasya Yasya Vashyat Kushteshu, Vishesha Ligam Udriktam, Tasyeva Shamam Puja, Tadaparamcha Anivandaram. This is very important as per the Charaga. Here, this is the case. 4 cases came to my OP. Most of them are referred by my students after became with their histopathology side. All are diagnosed case of psoriasis by a allopathy doctor. All 4 psoriatic. In all the 4, the treatment will be different. So here, think this is the Vata Pitta condition. The dosha is more Vata Pitta. Here it is Kapha Pitta is more. Here it is Vata dryness is more. Here it is Kapha Vata. Here Kapha Vata. Here Vata Kaphaja, here Vata Paitya, here Pitta Kaphaja. The 4 cases diagnosed of psoriatic patient. So here the treatment will be good. Here you can give Manjishta Kashaya, here you can give Padavana Kashaya, here you can give Guluchya Kashaya, here you can give Aragoda Kashaya as per the dosha. Then you will get a good result. Or if you are giving anything, and here you can apply Ayyapala. Here you can apply, but here you don't apply Ayyapala Kerasai. It will increase, it will become pustular lesions as happened to the first case I had described. So this is approach of Ayurvedic doctor in the psoriatic patient. So forget about the psoriasis. Of course, you take it. It's a pathological, you can think in our and think which dosha is increased. And what are the pathology? Also, think that what is the actual etiology. What is his lifestyle? What is his job? Whether any stress, family stress, financial stress, job stress, like that. Analyze the patient and identify the exact cause. Yogatnyanarthamevado yatnagajo bhave sadita sikriyaramba. Charaga says etiology is very important here. Now, this is one of the cases. Okay, here, this is a diagnosed case of psoriasis. Whether this psoriasis or sitma. What is the dosha? This is more Paitiga, this is more Kavaja. Dryness is more, this Snigdha is. Dosha is different. The medicine will be different. Approach will be different. here, and some differential diagnosis. Actually, this is a psoriatic patient diagnosed psoriasis, and this is tinea corporis. This is fungal infection. This is, you can call it sigma kushta, or as per the condition you can. This is different. Here, this is typical case of diagnosis psoriasis, and this is tinea capitis. This is the fungal infection. You will see some sticky appearance of yellowish color. Here, itching, erythroderma. Actually, it is called erythroderma, not psoriasis. This is called erythroderma. This may be eczematous erythroderma or psoriatic erythroderma. And here you can call it dharanagam. You can call it arumshika or dharanagam. In that case, you can treat it. Here, it is psoriasis and it is eczema. This is different. This eczema actually conduct of the detergent. Here, lichen planus and psoriasis. In lichen planus, the lesion will be red, violaceous, papule, no oozing, no only pure water, no pitta attachment. Here, and these are different cases. Actually, both the cases has power sites we can diagnose as a sigma kushta. Both are successfully treated cases. But actually, this is case the modern people diagnose as psoriasis. And this case, the modern people diagnose sarcoidosis. This patient is sarcoid, it is a fibrous tissue disarrangement, metabolic error in the fibrous tissue of the skin. It's called a sarcoidosis. You can refer in a dictionary. And in this modern people diagnosed as psoriasis. But unfortunately, this is an allergic patient. His Ig is 2,500, and his ESR is very much rising to up to 60. And the patient had allergic disease previous. So this, even though it is psoriasis, we will consider it as a pitta anamanda vyadhi. And here it is, you can diagnose the sigma kushta. And pure sigma kushta you can treat successfully. So that is our differential diagnosis. Now, so what is the approach for Ayurveda? Our approach will be classic kushta treatment. And Vatagabahara or and dosha shamana. And incorporation of Dushi Visha is also very important nowadays with the etiological factors of Gata. And psychological aspects would be considered. And approach Patya Ahara Vikar should be there. In that, Nidana Varivardhanam, Samprapti Vikatanam, to promote the three is very important. If the patient is itching, you have to do shamana of itching, or any other signs and symptoms, you have to do shamana treatment. And Nidana Varivardhanam is very important. Samprapti Vikatana is Shodhana Chikitsa. You can do as per your convenience or as per the condition you can do. Here. So our principle as per that, management principles are Tuk Prasadana, Vasrodha Shodhanam and Dosha Shamana. To relieve the symptoms, to reduce the inflammation, restore the circulation, clear the metabolic channel, prognosis depends on severity and chronicity. Consider Vyana Vayu and Brajaka Bittam here. Because Vyana is all over the world, all over the body, it is circulating. So the Brajaka Vitta will be deranged. And in that Vataka is increased and causing this exfoliation or Tokivigalam. So in that, treatment is like, actually what is the pathology, So you think about the Sukshma of the skin. Here, in the skin, if you are thinking the Sukshma level of the artery will be there passing the venous. And in the interstitial fluid, in the dilated lymphatic system. Here the skin is developing. Normally, the artery passing the pure blood, if the pure blood is there, it will give the nourishment to the cells. If you are keeping the interstitial fluid pure, the cell viability will be there. But due to the etiological factors, the specific gravity and the flow, etc., here is the Rakta Dushti. The Rakta Dushti means the content of the blood, specific gravity of the blood, flowing of the blood, everything will be altered so that the capillary will be dilated. So the hydrostatic pressure and osmotic pressure of these will be altered. The more and more impure things will be accumulated here. Due to that, the interstitial fluid is not viable situation to the cell. The cell will be altered, the pathology will start. And all the veins will be also dilated. And lymphatic system also. This is called here it will happen into almost all the skin disease is the pathology. Here, the treatment will be the Shodhana. That is the Kushta is Shodhana Purva. If you are doing a Virajana, that Virejana will cause some negative pressure in the venous. Due to the negative pressure, more and more accumulated dosha will be absorbed the venous. It will cause the change the hydrostatic pressure, osmotic more and more pure fluid, pure nutrition will become. By that, if you are clearing the Srodha, this interstitial fluid will become viable. The cell will be very, very active. Even I told you the energy vibration in the cell, in the mitochondria will be become normal. So that the exfoliation will be, we can stop. Or this is the basic principle of management of the or Samprapti Vikritam. So here, Srodha, we shall clear the, so we have to give the Srodha Shodhana, Mala Vilayana, liquefy the stagnated fluid, and Kaba Sravana, remove the accumulated fluid, and Mala Shodhana, eliminate the endotoxin. In Ayurveda, Tuk Prasadana Karma is doing by Shodhana therapy. So that is the Shodhana important. By only Shodhana, this will be cleared, then only the pure Dhatu will come. It will take time. That is Kushta Pacha Pacha Chardana Peda, some sloga is there. So here, Shodhana therapy will be Vamana, Virejana, Vasti, Nasya, Rektamoksha. Means Vasti, Nasya is not so relevant in Sidma Kushta or psoriasis, or in the specific treatment like Takradara, Navarleva, Kayasaka, Lebra. Here, Takradara is very important as the patient will be having stress. But nowadays, the people are not doing Snehavana. In Pitta doing Snehavana, the patient get Takradara. Simple, some slight relief, but again it is coming. So here, Snehavana is a must. Why? Because Snehavana and Svedana is a must. Then only you will get the pure good result by doing this Shodhana therapy. Purva Karma is a must, or it is very important, because the effect of Shodhana will be, it's actually the Shodhana therapy is a biopurification therapy. The biopurification is two types: transmembranous purification and transcutaneous purification, to clear the interstitial fluid or the accumulated debris or accumulated toxin will be absorbed through the venous pool. It should be eliminated and excreted through the urine or fecal. So this Snehamana and Svedana stimulate this biopurification therapy or transmembranous purification and transcutaneous purification. After that, it gets transenteral purification therapy by Pradhana Karma, Vamana and Virejana. And after this, you can be systemic purification by Raktama. These are Panchakarma related subjects. Very Panchakarma MDs think about this. These are the effects of Shodhana in our body. So by this, you will get a good result. So important of Snehamana, Shodhana acts through the systemic channel. Purva Karma acts through the biomembrane. It stimulates the diffusion process. It fulfills the effect of Shodhana process. It has both curative and preventive aspect. So Snehapanam is a very, even with Snehamana, also you will get a good result in the psoriatic patient. So that is the matter. Some of the example, my experience, effect of Shodhana therapy. This after Snehamana, you will get a good result. After Snehamana only, we got this treatment result. Here, actually we call it Erythroderma after the scientific treatment. Snehamana, Svedana, Virejana. And next, this is also a diagnosed psoriasis patient, but this patient is from near Tirumadi, Kozhikode district. Immediately after the marriage, only few lesions, they consult their Paramparya Vaidya there, and they given Ayyapala care medication all over the body. So after treatment, here, this is a 13 years old girl from Chennai. Simple application, we can manage successfully. So this is Palmar plantar psoriasis or Vipadia after the. Here we did Talapodichil for the more Vada is more to redeem the Vada. And so these are the Shodhana treatment, Panchakarma treatment. So Shamana Chikitsa, it is not easy to do Shodhana Chikitsa. In the OP level, in the Shamana, you can do. Medicine will be Agni Dimana, Dosha Shamana, Srodha Vishodhana, Rakta Shodhana, and Mutra Mala Shodhana Yagit Samrakshana. Or you can call it metabolic improvement, liver protective, diuretic and protective. So here, internal medicine, the medicine if you are purifying the body, it increases the urine output and evacuating the intestine. Clear the channel. Eliminate the unaccumulated mala by negative pressure, improving liver function and detoxification the endotoxin. Stimulate the Dhatu Poshna. You can give Rasayana drugs also for Dhatu Poshna in that case. So this is So what are the medicine? Easily available. Enough medicine you are getting. Kashaya, different kashaya. As per the dosha, you can give kashaya. I am not a medical officer. You are very familiar with the kashayas. But, and here, some of the medicine I will prefer. Ilyadi Gulija, Dushivshadi Gulija, Kaishwara Gulgulu, Haridra Gandam, or Alakhandri tablet, Arogya Vardhani, Annabedi, Loka Basmum, and Gandagrasa in rare case. So, only study the dosha and study the this part. I study the medicine very, very well. Then only you are supposed to give the medicine. Don't give all the medicine you are dispensing. I am seeing some of the prescription, all the medicine, even Guluchi Adi, Parandiadi, Guluchi Adi, Manarnamadi, Arogadadi, about 3 or 4 Kashai mix, and 2 item external. And all the medicine are extra Kashai, all the medicine you are giving to satisfy the poor people. And they, oh, we have got a lot of medicine. No, only give necessary medicine. You can do Kai Seka with your Kashaya. Even the Pitta Kabaja, you do Guluchi Kashaya, actually Kai Seka. That will be more good if you are giving more Kashaya in time. Don't waste the medicine. Don't give more medicine. And I'm seeing a lot of the pattern medicine also. Sora tablet, Sora. No, you didn't give only necessary medicine. Here, you can give Eladikaram, Lakshadikaram, Parandyadi, Panjavalkari, Yuvatyadi. And you know, Yuvatyadi Thailand is prepared with the Ayurvedic. It is very effective in the dry lesions to improve the luster and improve the dhatu. Actually, it is actually indication of Yuvatyadi is the development of the breast. But it is increased the mamsa dhatu, it stimulates the circulation and the portion of mamsa dhatu will be increased. Here the dryness is there. So more and more this Jalabhuta will be accumulated in the body. That is the Yuvatyadi. And Jivandyadi, Yamaka also you can use. Sora oil, I told you thing. Sora oil, I told you the incident. Only give the Vata Vata condition. When Pitta Pragati, Pitta Nivanda, you don't give Sora oil, psoriasis, it will be increased. That is very important. Now, most important, Pathya. No, it should be advised non-spicy, vegetarian type. Proper nutrition with enough fruits and vegetables. Drink a lot of water and fluid. Proper sleep, healthy family communication. And it is better to avoid non-veg, fast food, bakeries, smoking, tobacco, alcohol, and also Nisha Jaga. Think the quotation. Shaliyo Yavagodum, what you can do? Yavagodum. Mudga, Masura Suvari, Tiktashagani Jangalam, Kaipan Padala Upperi, Cherubay Upperi, Mudgam, and Chaudram. And not to Amra Levanol Kadam, Dedi, Dugda, Guda Anuba, Tiramasham, Tegetaram, Anuba Mamsam, Dedi, Gudam, Tira, Masham, Amra Levanam. Nowadays, fast food is more Amra Levanam. And most of the people are taking Dedi. Like that. So, Madhyanya, Madhya, Datri, Kadri, you can give this one. And as per the Nidana, this is very important. It is better to avoid all this. Then you will get a Nidana Parivan and it will not recur, as per my experience. So here, I will tell you some of my experience. Shamana prescription, as per one of the part of my research. You see, suppose the patient I told you, diagnosed case of psoriasis. And my diagnosis is, you can call it, I told it as Visarpa. It is Vada Pitta dosha. So here, 2 protocol you can adopt. Either one, Viredana and Gram you can give, and Pradisarna and the Lepana you can give. Here, otherwise, you can give Guluchi Adi Kashayam, and Tribala Gulgu, Vilyodi and Chandra Prabha, Navasa Mulia, Yuvatyadi Thailam and Eladi Gerthailam application. Or this, but this patient is not willing to take a Grida. And she's telling that he has some slight cholesterol. The cholesterol he can give you, but he's not, if he is coming, he will be there. I given this prescription. Being Vada Pitta dosha, Guluchadi Kashayam Tribala Gulgu, Vilyodi and Chandra Prabha, Navasa Mulia for the Dhadu Prashna Rakta Shuddhikara, Yuvatyadi Thailam and Eladi. So after 2 weeks, if you are given this result, you will get. After 2 weeks, okay. Now this you can give only Eladi Gerthailam and 1 teaspoon Grida daily and Ayragandam or Dushi Vishari Gulika night. So this will be the approach of Shamana Tirtha. Now this, along with that, psychological aspect, that is reassurance, educate and counsel. You have to teach the patient, this is the disease. This is coming due to this nidana. So your lifestyle should be changed, otherwise it will come again. Medication, if necessary, only a necessary medication you do. Along with that, you can advise yoga and meditation. Along with Deva Vyavasha and Sattvaja Chiefs also you do. And I'm usually prescribing some Namopadi treatment. Namopadi, I will told them to chant any Vishnu Sahasranamam or any other mantra, any nama. Daily, half an hour morning and half an hour evening. Because our side tell, Prada, Dama, Yamaseva, Yagashila, Biyogo, Dija Guru Surupuja, Sarvadatveshu Maitri, Jina Jina Suradara, Bhaskar Aradhanani, Pragadila Lavabangustamunu, Bhaskar, I will also tell them at 10 minutes early sun bath. Early sun Bhaskara. Bhaskara means what is Bhaskara behavior? Why Ajarya put instead of Surya Aradhanani, instead of the Bhaskara Aradhanani? Bhaskara Bha Karodi Idi Bhaskara. Bha, that is the early sunrise of the light. That is Bhaskara. Bha Karodi. It is called Bha, Bhadi, Lester. The early sunrise that will give more vitamin D, more urjam. So most of the patients will have vitamin D deficiency in psoriatic patient. So the sunrise sunbath will increase the body. I will tell all of them to do Surya Namaskar in the sun and the sunrise in the open space. And some Namapada, some psychological Deva Vyavasha Chikitsa. Here, what is the importance of Deva Vyavasha Chikitsa? In our science, Griheshu Anuguneshu, that is the importance of Deva Vyavasha Chikitsa. Griheshu Anuguneshu. What is it? Actually, everything in the universe vibrates. I told you in the skin, the vibration of the mitochondria will decide the exfoliation. So, vibration of the mitochondria will decide the vibration of the cell. The vibration of the cell decide the indactness of the skin in the dosha, the force in the epidermal and endermo-epidermal. So, these are force keeping by a uniform some vibratory force. That should not be, if that altered, the disease. So that is coming normal only because of the psychological approach. So here, that is called everything in the universe vibrate to the movement of electron, protons, and neutron of the atom. At cellular level, bodies are nucleus surrounded by rotating waves of energy. This is influenced the nature, especially in our graha. Because our body, even our earth is rotating its axis, and the earth is rotating the sun. So by this rotation, the energy vibration is happening on the body. So the earth will coincide with the sun in a specific time, specific month, specific area. That force influences our body. So by that, our observe the effect of Shani. I observe because as part of my research, I had documented 50 patients with the full. And also I observed their horoscope also. In that horoscope, observe the effect of Shani Graha and Rahu Graha in out of 30 and 25 out of 30 patients I evaluate the horoscope. 25 effect with Rahu and Shani Dasha. Normally, as per the horoscope, Shani Graha and Rahu Dasha is causing this type of disease, chronic skin disease, chronic Tuguraga. So in that, Rahu and Shani is most important. So in the don't fully believe, but it's a sign. The Jyotisha is a sign. So here the mind vibrations are there. So give some pacification or psychological approach only. So for that, you just to do some counseling and psychological boosting. Also tell them to keep mind calm and go to any other. I prefer this Nama Japa. Japa Yajnana, Japa Yajna Bhagavad Gita. By Japa, you can do inside concentration. The distraction will be low, the vibration in the body will be over. And by this, so, what is my research? My research is a C project. Scientific, economic, effective, and management. That is our holistic C project. Here, scientific, economic, scientific treatment, economic treatment. Nowadays, the patient is coming, will cost, the people write minimum 2,000 rupees. I want only 50 rupees per week. Here, so this patient, one of the example of my research work. This is a diagnosed case of psoriasis. Here we want as per the pathological or samprapti vigana. In this case, I will give Kaishari Gulgur Vilyadi Chandra Prabha 3 times a day only. And this Kaishari Gulu for Dosha Shamana, Vilyadi Gulia for Jaguga Shamana, Chandra Prabha for Dosha Shamana, Srodha Shodhana. These only. And actually, I wash with salt water for Kabashamana. Pradisarana, and applying coconut oil or Vadasham. And along with it, Pathyam, morning only kanni, lunch rice with vegetable, night only fruits, daily 30 glasses of water. And also I applied Pathyam with Namopani, and also 20 minutes sun bath, some relaxing techniques also, yoga, meditation like that. These are applied, and if you are giving this, the result is within. This is the result we are getting. The scientific economic effective management. Here only 50 rupees per week. Only these three medicine. Only these three medicine will cost. We are giving one TDS for 1 week, 7 days will cost only 50 rupees. So this is my research project, and I am still doing my research project. So this is after my just for get rid of the psoriasis, wholesome food, pure nature and iron, cleanness of the skin, sufficient sleep, necessary exercise, proper sex, calm and peaceful mind, and avoid curry, worry, and hurry. So be happy and be healthy. Avoid the curry, worry, and hurry. Nowadays, the curry, all the spicy food, and people are worrying, and they are very, 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 very hurry. Even though they want to hurry to get rid of this disease, but it won't get rid by the hurry. It will take time. It will take 2 weeks, but you have to keep the pathyam for years, or change the lifestyle. That you have to educate the people. So I think, so let me conclude. If you are approaching psoriasis, forget the word psoriasis. We can manage effectively and economically the patient suffering from psoriatic type of disease with Ayurvedic principle. We should consider the physiological, pathological, psychological, sociological, and economical aspect of the patient. The Yukti of Vaidya plays a major role. So be a Vaidya. What is a Vaidya? Who is a Vaidya? Vaidyan will treat the patient, not the disease. You don't treat the psoriatic patient, psoriasis. You treat the psoriatic patient. Natural approach will be very, very good. Actually, that's all from me. You can contact me if you have any doubt, if you have any further knowledge you need. You can attend our Dermatology Institute online class on Ayurveda for theoretical and practical training. You can contact in this number. You don't contact my personal number. Dr. Ashwati, don't give my personal number to anybody. You don't get you don't contact with my personal number, and you can contact with this number only if any doubt anything, because you will get answer. If you are contacting my personal number, I will not, because only after night 8 o'clock and I will open this and to some of the groupies made. And I will answer to my group only. Personally, individually, I will not answer to any question, because everybody, sir, what is the disease? What is the diagnosis? Usually I am getting people, they will send a photo. Sir, what is the diagnosis and what is the treatment for this? Nothing else, only a photo. So I think you will not get any answer from that question. So if you need doubt, if you want to more knowledge, you contact in this number. And if you want, you can attend our online class. That's all from me, because you are also welcome to our online classes, which we got the number onwards. Our online class next 2 batches over. This is the 3rd batch is coming on number. The classes on exploration of Agata Dandra, 4 days class. Agata PG, Agata fresh, you can apply. 2 batch already trained, and clinical analysis of Kushta. Understand the Ashtadasha Kushta in the clinical level. And Kushta Chikitsa, effective Kushta Chikitsa. And we have Sukyoga Saptaha, 7 days of class on Dokuraga. And Raktamokshana theory and practice. Clinical toxicology. How we can apply the toxicology or Agadandra in the clinical level. And Bala Visarva, that is Karappan. For first year students, understand the basic principle. Next, we will start on contacting this number, you can contact. So what I'm telling you, after attending the class only, they can understand the clear knowledge. And if they, after attending the class, if anybody is interested, they can come to my hospital for a clinical training also, 3 months or 6 months. Depends that you can, for that other criteria is there. That will be evaluated, your intention for the training, like the evaluation. And the training will be a different types of training. It's a traditional training. You start from 6 o'clock to evening 8 o'clock. So that you can have anything, if you want anybody, you can want. I think you can contact this number, Okay, that's all from me. Thank you very much.